Hello, everyone. Can everyone hear me or see me? Can you please let me know in the chat box, the comment place that you can hear me well before we start? Hello. Miss you guys. Now that we are not being really locked down anymore, has everyone been going everywhere, having dinner? Hello? No one can hear me. Right, clear. Thank you so much. Great to see all of you. I saw some, old faces and new faces too. Thank you. Okay, so yeah. Right, great. First of all, I would want to thank all of you to take your time to come here. And I would want to let you guys know why we are actually having this topic today. I think about a month plus ago, I asked in our Pets Heroes group, which is our members group, PetMedic members group, that what kind of topic that they want me to share. Because every 2 or 3 months times, right, I actually promise them to have a class to teach different topic. Sorry, I got disconnected. Don't know why. Can you hear me now better? Right. Great. So about a month plus ago, so Margaret actually came out to ask me about this question. I was a bit hesitated to share this topic again because I think a while ago, almost 2 years ago, I've shared this topic before. But after that, Bacon Daddy come out and tell us that, he doesn't pass the antibody test, went for the vaccination, and then suddenly have a bloody stool and all that, and I think vomit. So that's the whole reason why that we are having share this topic today. And I really think it is very important that you guys know, because every one of you go for because you guys are so responsible, right? You're the good daddy and mommy. So you bring your pets for vaccination every single year. The doctor say one ma. Why you go every single year? The doctor say one. Huh? That's all. So if you are the responsible pet owner, you only stuck that there. It's like the doctor say, I follow. But you guys are extraordinary. You guys are the pet heroes. So you guys are one level higher, okay? So you need to know why you need to do it yearly, and why some of them, we ask them not to, go for antibody tests and all that. Why? So today is the opportunity. I take this opportunity to share with you why. All right. For new people that just know us, I just want to share with you guys who we are. Okay, we are actually the Malaysia first pet first aid academy. Okay, our mission is to educate as much as owner as possible for pet first aid. And not only that, we also want to share with the owners about all this medical knowledge as well. We want to make this medical knowledge, who actually only belongs to doctors and nurses, in a very simple language that all of us, the daddy mommy, would know, so that we can actually pick up things earlier, so that we can actually prevent, or even do something about our condition. All right, so share with you one more story. 2 days ago, I saw a pom which belonged to a very dedicated mommy. Okay, went to a vet, get herself, get the dog check, and was diagnosed with heart issue. But because it's V1, so that is why the doctor say, oh, you don't need to go for medication. Nothing else that you need to do. But that mommy gets very worried. So after 1 year later, we saw her again. Then she says, I listened to the heart. The first thing I said, hey, your dog got heart problem. They say, oh, doctor, I know, like almost 1 year ago. that I know this, but I didn't do anything because I don't know what to do. So these are the things that I think we really can educate you guys. Yes, we don't need medication, but we can actually look into it with the food, like nutrition point of view, what we can do, what we don't do. And then after that, we can also talk about some, supplement, what kind of exercise that you can do, what kind of exercise you can't do. So I would really appreciate, in the Pets Hero group, in Facebook close group, I really appreciate if, sometimes I ask you question or anything that you want me to share, in the upcoming sharing and classes, please let me know, because I would really want to share what you want to know. I don't want to share, or I don't want to know, or I don't want to tell what I want to tell. It won't be valuable, right? If any one of you agreed with what I say, that I want to teach what you like to learn, please give me a 99. All right. Okay. So with what we are, I want to tell you about pet immunity, which is what we want to share with you today. Are you guys ready? Guys ready? Please type ready for me. All right. I still have to start with some very the definition and all that. So I will tell you a lot about medical stuff, but I'll make it very, very simple for you. So I'll tell what the medical stuff is, and then I'll tell you in a layman language. All right. What is the definition of immunity? All right. Immunity means that if somebody can actually resist that infection or resist that toxin, okay, that have this, produce this specific antibody from themselves, okay? What is the specific antibody? It means some white blood cell that actually sensitize. Okay, what is sensitized? You don't have to know all this. I have some very good explanation for you the next time you come. I mean, the next time you come. Well, I mean, in the coming slide, okay? So protection, it is the immunity means you have the ability to protect yourself against some disease or any particular disease. And then it is very, the body is very smart, okay? Imagine you have a triangle-shaped antigen that come in, a triangle-shaped virus that come in, then your body sees already, oh, it's a triangle-shaped virus. So I must make this triangle-shaped antibody because it's so specific. When it does that, then they will be able to protect you against that virus. Okay. Now I think you guys are very educated for this vaccination kind of thing because of COVID, right? But does immunity always mean vaccination? Does immunity always means vaccination? Okay, why we say that immunity always vaccination? Because before we get the virus, we take this virus-like thing, I'll tell you what viruses are, that put it inside your body, okay? So it's either weaken or kill or anything like that. That's why you have your Pfizer vaccine, you have your Sinovac vaccine, you have your AZ vaccine. All these different type of vaccine is in different category and how do they work? All right. So why we say that immunity always vaccination is because you don't have to go through that disease. You can have the immunity by taking this virus and implant it into your body. That means inject it into your body. We call it inoculate in your body. Okay, that's immunity. But definitely, right? If let's say a dog that has a parvovirus before, okay, and he or she recover from the parvovirus, then this dog will have immunity over parvovirus already. No need to vaccine for parvovirus anymore because he already kena before and then has this virus, unless it is like coronavirus, the virus keep mutating, it become a different virus or stronger virus or different type of virus that the immunity can't recognize. Then too bad, then you have to put on a newer or different strain of the vaccine. Okay, so far so good. If good, put a 99 for me, please. Okay, I want to tell you what 99 means. 99 means, okay, get ready on 99. 99 means you and your pet staying together forever. 长长久久, all right? Okay, but over the 10, 20 years, right, there are a lot of changes about vaccination. Everyone would think about, hey, vaccine, wow, vaccine again, vaccine will cause problem or not. Everyone heard about vaccine, right? Then they will start really think about whether it is really worth going for vaccine, what kind of thing it is. So last time, like 10, 15 years ago, or even sometimes now with some new pet owner, they will still think that this annual vaccine, the more strain, the better. Wow, more virus, better. You know, you previously have 6 in 1, tak cukup lah, 6 in 1, 7 in 1, 8 in 1, 9 in 1, 10 in 1. Then they come in, they say, doctor, I want the best one, the most expensive one. Okay, so, but to us, right, the most expensive, the one we have the most type of strains and viruses, doesn't mean that it's the best for your dog. Okay, for example, later I'll show you, like, I think as I was teaching, later I'll show you why do I say this. Why some of the dog, we will, even the owner very rich, you know, money not a problem. I want to pay you all the money that I have. You give me the best vaccine. Then we will tell her that, oh, no, you give this simplest one will do. This 6 in 1 will do. Huh? Why? You think I cannot pay? No, it's not about that. Okay? It's about whether your dog really need it or not, or your cat really need it or not. All right? So I'll talk about it when I talk about the diseases. So it is more like you have to do it like an individualized medicine already. Okay, so you go to the doctor right now, whether whichever doctor that you go, you already know what kind of vaccine that is more suitable for your dog or your cats. All right. So it is in part of the preventive medicine. So this vaccination is part of the preventive medicine. So preventive medicine, meaning to say that other than vaccination, you will have deworming lah, you will have ectoparasite. Ectoparasite means outside parasite, inside parasite, heartworm prevention, and all of this is actually a preventive medicine program. All right? Great. So far you understand, yeah? Okay. Now we go to something a little bit more complicated, but I think you all will understand, okay? If you guys still with me, can you please type MLV? MLV stands for Modified Live Virus. Okay, so a modified live virus. Oh, thank you so much. You guys are so cool. Right, great. For dogs and cats, the same, all right? Or even human, the same, okay? Modified live virus, it's whatever virus that you see, you know, like coronavirus from Pfizer. And, you know, there are quite many core vaccines that we have in Malaysia. And especially for cats and dogs, it's called the modified live virus. Okay, modified live virus is like this. It is the live virus, but they actually, the virus, the virus or the bacteria or whatever that is, it's actually weakened. Just weakened. It's the same virus, but they weaken it, okay? Or they actually make it like alter a little bit so that it won't be that harmful to our human being or to the cats and dogs. And then after that, still enough to stimulate the antibody. That means imagine they actually put it, the triangle shape one, they still put in the triangle, but probably less one side. Okay, so the body will still know that, oh, this is a triangle virus. So the power virus come in, they know that, oh, this is power virus. The distemper virus come in, they know that it's distemper virus. So the leukemia, feline leukemia virus come in, they know that it's leukemia. Okay, so that is called the modified live virus. As I was teaching, right, or as I was sharing, if you really have something that you do not know, you can actually type in the chat. If then I think it's something timely for me to share and explain to you, I will. Otherwise, you will have to ask again. at the end of the session. Okay. Second, what is the kill virus? Okay, if you guys okay with the modified live virus, then put in kill, K-I-L-L-E-D. Okay, a killed virus means actually is a virus, the same type of virus, but they actually kill it. Kill it means cannot cause problem at all already. So whatever the injection that you get, right, you will get the least reaction. So after you give the vaccine, after you get the vaccine, like how you get Sinovac, right? Not much problem, like okay, just. So some of the people get AZAC, right? What happened? Oh, fever for 4-5 days. Why? Because it's a different type of virus. Okay, different type of virus. They go into the body of the animal or the human. They actually react differently. Called the kill virus. Okay, this one quite easy. So usually this kill virus, they add in some adjuvant or things like that sometimes so that the vaccine lifespan can be longer. All right. Now, the last one is also the one that I really want to share with you because quite rarely that you actually hear in the human medicine. Subunit vaccine, or what we call, sometimes we call the technique like Recombitech. There's some virus company called Recombitech. Is that they use different kind of virus capsule put in the DNA or the RNA. DNA, you know what DNA is, right? DNA is the double cyclic, the DNA like human DNA. So virus is also having the DNA. It's because of the DNA, they know that which type of virus it is. They know which kind of antibody you have to come up with, okay? So with this Recombitech virus or the subunit virus, or what we call this recombined technology, is that they use a virus capsule, like an envelope that belongs to other things. Let's say a chicken pox virus, okay? A chicken pox virus capsule, but inside they put in the distemper virus or the parvovirus. So when it goes inside the body, when the DNA get released, the DNA still is actually the parvo or distemper DNA. So the body still can recognize and then still can produce the army, okay, or the antibody to fight against it. And then it won't cause any diseases or issue because, I mean, as in sickness, because this capsule, right, it doesn't belong to the vaccine. So it's not a whole vaccine. So it's not a problem because they actually deceive the body. All right, understand? If you still can follow, whoever that have dog types dog, whoever that have cats type cats for me. Then I would want to know how many cats and dogs owner that I'm talking to. So then I can actually tell you. Oh, wow, it's kind of a mixture. Very good. Thank you so much for responding. Quite a lot of cats as well. Great. Right. Because today, right, we don't really have enough time to tell all about cats leukemia vaccine and FIP vaccine because they are someone that actually asked me about it and wanted me to talk about leukemia and AIDS, because leukemia and AIDS itself is a huge topic that I probably need 1 or 2 hours to talk about. So maybe the next time we will be able to share with you about the leukemia and the AIDS viruses and vaccine, or what are the controversial behind it as well. Dog and sometimes cat. Very good, Josephine. Right. So this is actually how actually the World Small Animal Association actually recommend us how to vaccinate your dogs and cats. All right. So in dogs, we always start early. We always start early by 6 to 8 weeks. Okay. So that's why some of the breeder, I have to tell you about this. I know the breeder probably wouldn't like me when I told this, but because when they are puppy, right, they look so cute, you know. And when they grow a little bit bigger, it's not so cute anymore. So it's very difficult to sell them. So for them to be able to actually so-called push the puppy out when they are about 6 to 8 weeks, they would also want to vaccinate the dog first, because the owner who buy the dogs, right, would want to see the vaccination certificate. So sometimes what happens is they actually vaccinate before 6 weeks old. All right. So can put me up, right? So now you all can take a photo of this, and then I can tell you more about the dog and cat vaccination. Right. So most of the cats or dogs, puppy and kittens, right, when they really want to, yes, thank you, Josephine. This is what I want to explain to you guys. What happens if you vaccinate too early? All right. When dogs and cats, when they are really young, especially when they have the dam or the mummy with them, they will suckle their colostrum and all that. So when the mother and the dam, actually the bitch or the dam, actually have all the antibody with the vaccination that they have, right? Inside their colostrum or their milk, they will have this antibody. We call it maternal antibody. Who can help me to type it out? Maternal antibody. So with this maternal antibody, the baby already have the maternal antibody. So maternal antibody actually decline after about 5 to 6 weeks only. All right. If the maternal antibody is still very high, then you already give the vaccination, right? Then the antibody is there, then it will actually try to neutralize the vaccine that you give. All right. So the first vaccine that you give, right, it wouldn't be that effective anymore because of the maternal antibody. So the best is 6 to 8 weeks when they start lowering down, then only we give the vaccination. That's the best time. So that is why we call it 6 to 8 weeks. All right. But after 8 weeks, right, it will be too low already. Okay. If the puppy no longer stay with the mummy, but they have suckle when they were younger, yes. If they born straight away the first day, second day, no mummy already, then we have a different protocol. Then on the 4th week, we already start injecting. All right, 4th week. So if abandoned cats or dogs that you have, that you rescue since a very, very young baby, like 1, 2 days old, never have mummy's milk before, then 4 weeks old, you have to vaccine already. Okay. Otherwise, you have to wait until 6 to 8 weeks. Can? Right. Okay, let's go back to the... Right. Please note this down. Okay. So when you are in the, after that, right, every 3 to 4 weeks, you have to give the vaccine booster. Every 3 to 4 weeks. So 4 weeks is the best. So try not to do date to date. But some of the vets, because they want you to remember better, so then they put date to date. That means 30th of May to 30th of June. But if you see 30th of May to 30th of June, it will probably be 4.5 to 5 weeks already. Okay. So what you need to do is you try to be going to your vet to get the vaccine done, puppy vaccine, especially booster, 3 to 4 weeks apart. Okay, 4 weeks is the best. All right. So what you do is second one, it will be from, you see, that is why the first one, they say 6 to 8 weeks, right? The second one, they say 9 to 11 weeks. Why? Because 3 weeks after, they should be getting another vaccine already. Then you get a higher booster. Then before it comes too low, you give another higher booster, it goes higher, then it goes on stagnant. All right. So this is how it is. One more tips. Who have big dogs here? Whoever have big dogs like Rottweilers, especially Rottweilers, Dobermans, retrievers, golden retrievers, all of these big dogs, right? Please vaccinate them. The last vaccine should be at about 18 to 20 weeks. 18 to 20 weeks. So imagine 8, 12, 16. Okay, so the third booster is already there, but 16 weeks old only. Not enough. You have to go for another one on the 20th week. Understand? Okay. Well, if you start at 8 weeks, yes, you need the 4th vaccine. If you start late, let's say you buy the dog late, you start late, then the last one has to be at around 18 to 20 weeks. That's the best. Otherwise, the antibody that protecting parvovirus and all that might not be as good. All right. But definitely now we have the antibody test and all that. Later, I'll show you a World Small Animal Association, right? The standard, the real standard. That's why where we are teaching here, right? It's not only what I say, I always bring what's the world say. What's the world standard say, okay? We don't say that we are Malaysian, we don't follow world standard. We must follow the world standard, okay? We do the right thing, all right? So the third round of vaccine, then you can start doing your rabies vaccine already then. Then after that, sometimes you go on the annual booster, all right? This annually means all your heartworm tests lah. There are other things like body tela. I'll tell you a bit later as well. Okay, for the cat people, like come give me some meow in the chat room. Give me some meow. Great. No, usually it's not less than 10 kilo. Our big dogs is about almost 20 over kilo dog. 20 over kilo. Most of the Rottweilers and all that are more than 25, 30 kilos. Right? Generally, it's because Doberman, all these what we call black and tan kind of dog, German Shepherd, Rottweilers, and Doberman, all these black and tan dog, right? Research show that they tend to have lower antibody after the third vaccine if they are not reaching 18 to 20 weeks. All right. Thank you. Thank you, all these meow people. Right. If you can recognize, right, for cat or kittens, we do it a bit later. Why we do it a bit later? First of all, that maternal antibody lasts a little bit longer. Definitely the same thing if they don't have mommy at all, then we probably would start at about 4 to 6 weeks. All right. But if they have mommy, we always start around 9 to 11 weeks because they will be too tiny when we want to give the vaccination. And like all the vaccination that we get, you see you get 0.5 as an old person, as an adult. Even now the children at 12 years old, they still get 0.5 ml. So whatever dose that is supposed to be able to generate the antibody is the dose, is dose relevant. So if we use the vaccination, the tiny puppy, there's a lot of argument in overseas, by the way, but it's too little time for me to share it here. And because the argument with no significant studies, that's why I won't share it here. But the small tiny puppy, you actually still give the same dose as the big 40 kilo dogs, okay, when they come for annual vaccine. So for baby cat or kittens, we actually do the deworming. Sometimes if you want, you can alternatively go for leukemia vaccine, but the FVRCP vaccine is actually the core vaccine that we usually give. So you start at 9 to 11 weeks. And then after that, the second round, right, will be about a month later. And usually the third one will be the third month. And then after that, annually. All right, I'll share with you of this later. Some of the study shows that you must do it 3 months later, but this is not really what the World Small Animal Association recommend. All right, so what we will do is 9 to 11 weeks, and then after that, another booster after 1 month, about 4 weeks later. And then after that, KIV, yes or no, the third one. Why? Because some of them actually go for the antibody test. I'll show you the diagram later. All right. So what does the statistics say? That whether we really need to vaccinate our pets yearly. Okay, what do they say? So most of the research now shows that if you get your baby vaccine done well, when you go for your annual jab, you don't really need to go for your annual jab. Some of them say 3 years. Some of the research, right, the antibody titer is still high even after 5 years. All right. So what does it mean? It means that after you give this baby vaccine, you give another 1 year later, that means 1 year, 4 months. And then after that, after 1 year later, you test their antibody is still high. They test their another antibody will be still high. So if the antibody is high, meaning to say that they are protective, okay? They're protective over these diseases. But there's one thing that I need to share with you, okay? One thing. It is something called leptospirosis. Later, I'll share about this disease, about leptospirosis. It only lasts for about 9 months to a year. That is the whole reason why all your vets ask you to go back for annual vaccination. It is because of leptospirosis. You know, who know what is leptospirosis? Okay. Justin has a question. Is there a vaccine for FIP? We have an answer later. All right. But yeah, I want to tell you FIP vaccine itself, right? Another hour to tell. All right. So now why we need to know and why we need to change? Why all the vets are telling you 1 year to come for vaccination one, and why this doctor come and tell me otherwise? Okay, it's not that I tell you otherwise. I just want to share with you what is the right thing, and then you can discuss with your vet what is the best for your fur kid. All right. What we need to understand, there are some of the reports showing that injection site carcinoma. So overseas, right, there's a lot of feline practitioner or vet like to give vaccine here at the neck, okay, at the scruff where you scruff your cat. In Malaysia, most of us like to give it on the next to the thigh. Unless some very fierce cat or some very fierce dog that we cannot really control, then we'll do it at the neck. And some of the dogs that if we put it at the thigh, right near the thigh, then they can't walk for 2 days. But they put it at the neck, they are okay. But in overseas, last time, or even for quite a long time, for like 20, 30 years ago, they keep giving vaccination around here. Then they have a huge research talking about this feline injection site carcinoma. So this vaccination that being given there, not only vaccination, other injection as well, become this cancer. And because it is here, you can't chop the cat heads off, right? Can you chop the cat heads off? You can't. So because you cannot, that's why they just leave it there, and then the cat has to die because they can't do anything. All right. At that point of time, definitely, they don't really have radiotherapy to actually take care of that there. All right. So now all the recommendation will be at the time. Okay, at the time. So other than that, there are some vaccination kind trigger this immune-mediated disease. Sometimes trigger some blood clotting diseases and all that. So that's also one of it. But the other way around, right? There are this group of people called the vaccinophobia type. It's like all like human. They're so scared of vaccine. They think vaccine is super bad. They don't want to vaccine at all. So that's two different extremes. One, keep vaccinating too much. One is like, don't want a vaccine at all. So we don't want to be any one of these. Okay. Right. So whoever that is ready for dog vaccine, I'll tell you what we have actually covered in dog vaccine. All right. What kind of diseases that you every year go there and jab with your dogs and cats? You know what kind of diseases that your vet is trying to prevent you on. All right. Okay. This is from the AHA. Okay. AHA is the American Hospital Association kind of guideline. Is that what are the core vaccine is the distemper virus, parvovirus, adenovirus, and rabies virus. Okay, here in our country is slightly different. Why? Because rabies vaccine is not really a core vaccine, because we used to declare ourselves, not the pandemic area for rabies lah. But because 1+2 years ago, there's an outbreak in Penang area or northern area, we are actually already being categorized again as the danger zone now. So whoever that actually need to move their pets, cats and dogs from here to another country, rabies vaccine is a must. All right. So in our core vaccine, we actually have leptospira, we have influenza, parainfluenza, and then also adenovirus. Okay, that's all the core vaccine. So the non-core vaccine for them is all the Bordetella. Bordetella is kennel cough. Bordetella or Lyme disease. Lyme disease don't have it in Malaysia. Okay. So how do we know where are the organs actually affected? All right. So distemper virus can cause brain, intestinal, okay. Canine bronchitis is here. Canine parvovirus, as you know, is vomiting and diarrhea. And then rabies, you know how rabies is. I already explained to you in the zoonotic talk, okay? If you can remember how the rabies class is. And I think we have a specific rabies class before, I think, if I'm not mistaken. Infectious canine hepatitis, okay, and canine coronavirus, okay. Actually, coronavirus in animals, right, has been there for a long, long time. Coronavirus vaccine in dogs also has been there for a long, long time, okay. It's just a different kind of coronavirus. Okay, for distemper, I need you to remember all this because that is how a distemper dog look like, okay? Because it affects the brain, the respiratory system, and the gastrointestinal system, means the vomiting and diarrhea. So most of the time, they will have vomiting and diarrhea. Then they will have, because they cause the respiratory tract to have problem. So they have very bad greenish nose discharge, greenish eye discharge, and then in some very severe or long standing distemper, they will have a very hard paw pad. Okay, hard paw pad. If everyone is with me on distemper, can you please type distemper for me? Right. So what happened to distemper is that when you have all this, right, and then eventually, because it also goes into your nervous system, so what happened is you could see them having seizure or jerking. Okay, some of the dog jerks here, very typical one jerks here. Okay, if you see stray dog that jerks like that, after you touch them, please sanitize yourself before you come home and touch your own dog. I know some of you are very, very kind. You all have been helping the strays or even feeding them, or even sometimes help to capture them. But then if you can recognize this, it will be very good. Then you will know that, this dog probably have distemper. You can actually send to the vet right away. Okay. But to be very frank, if the vet don't want to take your dog in, please do not blame them, because distemper is a very highly contagious disease, okay? If they don't have a proper isolation place, if they take in the dog, it will be harmful to other dogs as well, all right? So let's say if you're now smarter already, okay? You have learned this in my class, you already know that, oh, Tom, there's a lot of greenish discharge and greenish nose discharge. And then it was jerking a bit. Wow, it could be distemper. So when you want to go to the hospital or the clinic, give them a call and tell them that I suspect the dog that I actually going to bring in could be a distemper. What should I do? Okay, so the receptionist, if they are well trained, or the vet, speak to the vet, if they know what you're saying, then what they do is they will probably ask you to wait in the car, or wait outside the door, the clinic or the hospital, and then they will take the test kit, come outside, do the testing before they tell you what to do, or whether they can admit or they cannot admit, or they have to refer you to somewhere else. Okay? Because if you do not know, if you go inside, wait at the lobby of the clinic like everybody else, and then after that, there's a small little cute puppy that, you know, someone just bought a pom puppy, let's say, you know, like just 2 months old, and then see your dog very cute, go kiss your dog, die. Actually, after 2 days, you will definitely see the puppy contracted with distemper and eventually pass away. It's very sad because we actually have one puppy that comes to us because of that. And we see him deteriorate bit by bit. And it's very sad. Okay. And the owner don't even know where the puppy contracted the virus. All right, very sad. Okay, next. Next is parvovirus and coronavirus. Why I actually want to put them together is because parvovirus, as you can see, look at the intestine. I'm very sorry I give you this, you know, bloody kind of intestine lobe. This is after, we call it post-mortem. That means after the dog passed away, they take out the intestine. This is how it looks. Okay. The intestine is so bloody. Why? Okay, why? Now I want you to see the diagram at your right hand side. Okay, at your right hand side. Coronavirus, there's this intestine loop, villi, we call it villi, it goes like that, up and down, right? How to tell you? Okay, up and down like that. So up here, coronavirus always attack up here, the cell up here. When the cell up here is being attacked, they can't absorb the fluid properly. So all the poo-poo that come out is watery. Okay, but it's not bloody. It's watery, yellow watery, or even brown watery, but never bloody watery. Okay, but for parvovirus, the virus is so smart. Okay, so smart. Actually, it's their target cell. They target the actively producing cell. You see, the target of the parvovirus is down here, because down here there's something called the creep of Lieberkühn. Don't have to remember the name. The creep of Lieberkühn. All right. I say this name is because in the vet school we have to learn that. Okay. This creep, right, is actually where the factory of the intestinal cell is. The factory, they just keep generating the cell and then push up, push up, push up. So it's generating here, push up, generating here, push up. So then at the end of the day, you will have new cell over. So you slough off this, new cell come out, slough, then the new cell come out again. Okay, that is how you see. So the creep of Lieberkühn, which is down here, where the parvovirus is, down here is where all the blood vessels and all that are. So once they actually contacted it here, that is why you will have bloody diarrhea, because it's affecting the blood vessels down here. Understand? So when you have parvovirus, you have watery, bloody diarrhea. Okay, that's what you get. And okay, since all of you are here, and I just take a little extra time to tell you that if you see bloody diarrhea or bloody stool, but it's not watery, it is like, you know, gel-like or pasty, it is not really a parvovirus lah. Because parvovirus is always watery. Why? Because it caused the problem in small intestine. If the dog is having indigestion or all the other thing, or colitis and things like that, they affect the large intestine, which you don't have watery stool, because the stool, the poo-poo has passed long enough until the end, right? It's not that watery and shooting anymore. All right, great. So who knows that? Who have seen the parvovirus diarrhea that have shooting bloody diarrhea? Tell me, say me if you have seen this bloody diarrhea. Okay, bloody shooting diarrhea. Yeah, a distemper and die in a few days. Yeah. Thanks, Sabrina. Serena used to be a vet nurse. All right, great. Canine infectious hepatitis means is a type of disease that actually cause hepatitis. Hepatitis is liver being infected. Okay, and because liver is infected, you get jaundice. So you get jaundice. There's not much thing that I'm going to tell. Most of the time, sometimes when they have this virus, right, you do see the dog's eyes turning a bit bluish and all that. But most of the time, you won't really see that, and before you actually see the jaundice. So most of the time, you will see the jaundice. All right. So nothing much to share with you this one. Very quickly, we go to canine influenza. Canine influenza, also not much really to tell because it's just like very sick dog that have running nose, they have nasal discharge, loss of appetite and all that, right? Okay, leptospirosis. I'm going to spend a little more time on leptospirosis for you, okay? Leptospirosis actually, whoever that has come to the zoonotic class will also know already. Leptospirosis actually carried by rat, okay? Rat and rat urine. So the rat has this leptospira. They actually pass it down with urine. So where they do, the rats go around, go to the water pile, go to the longkang, go to the swamp area, go to the wet area, go to the pond area to pee and all that. And sometimes you're also in this thing like waterfall. So if you like to bring your dogs to the waterfall, you also should be very careful, okay? Because the urine of the rats can actually have this. That is the whole reason why when we drink the canned drink, we always wash it first before we drink, because the rat urine can also cause human leptospirosis. And human leptospirosis also can cause human to die. All right. And leptospirosis sometimes affect other creatures as well, like cats as well. But why we didn't really talk about it, because it doesn't really show clinical diseases, okay, in cats. Right. Next. Right, for the cat people. Cat people, say cat for me. Thanks, Justin, for the quick reply. Right, great. Okay, Joyce, thanks. Right, for cat, right? What are the core vaccine? Do you all know? People always tell you what are core vaccine is what we call the 4-in-1. All right, we always call it 4-in-1. What is the 4-in-1? 4-in-1 is actually panleukopenia. Okay, this panleukopenia is whatever other people try to tell you the feline parvo. Everyone will tell you this panleukopenia virus is actually the cat parvo. Okay, why they say so? I think most likely because the way they exhibit their symptoms because they are also having very bad vomiting and diarrhea, and sometimes they do have a bit of bloody diarrhea as well, but it's not really frequent, as you can see. So in a very bad situation, in a very terminal stage, then you will probably see the bloody diarrhea. Okay, when you have this, it's actually very contagious as well. Most of the time, they can't last for a week. Okay, if they last for a week, most of them survive. Okay, so definitely we have other things like rhinotracheitis. Rhinotracheitis, you see the word very long, right? Never mind. Rhino means your nose. Tracheitis means the trachea means the windpipe. So the nose all the way to the windpipe. Itis is inflammation. That's all. Easy, right? You see, medicine, not difficult. Okay? Rhino is the nose. Trachea is the windpipe. Rhinotracheitis means here and here affected by herpes virus. Okay, that is why it's also called the FHV, herpes virus. Okay, sometimes it causes the eyes to be different color as well. Right, don't have to remember. So that's why I give you all this layman kind of way so that you can remember it very well. And do you realize that whenever I talk to you about this and when I teach you this, I do a lot of facial expression and the hand expression because I need you to understand and remember, at least remember what actually you know, the movement and all right. Calicivirus is one of it. I'll show you all the photos later, all right, because I think picture paints 1,000 words. And the other one is 1, 2, 3 already, right? Rabies is not one of the 4-in-1 vaccine. It's the chlamydiosis, okay? Feline chlamydiosis, chlamydia. When you have chlamydia, FPL, FHV, and calicivirus, 4 of these is the 4-in-1 that you have been taking yearly. All right. Rabies is one of it that you have to know as well, especially if you want to go for overseas. And then I'll answer what Justin asked. Is it Justin that asked just now about the FIP? Leukemia disease and FIP actually have vaccination. FIP vaccine is a drop-on vaccine because FIP is a coronavirus, right? Now we know coronavirus so well, and I'm sure you know coronavirus so well that you know that it keeps mutating. So it's very frustrating because FIP is a coronavirus that is inside the cat body, and then it mutates, become the FIP virus, which is going to kill the cat, not the coronavirus that first go into them. So it's a very controversial thing that whether we vaccinate against FIP or not. And the last FIP vaccine that we use in Malaysia is the one that actually dropped on into the nose. Okay, we call it intranasal. Do I answer your question, Justin? We can actually talk about all of this again next time if you want to. If you are really interested with FIP, do let me know in the membership area in the closed group, Facebook closed group. I can share with you. I spent many years working with FIP. That's my 17 years ago. That was my final year project. So I do a lot of research on FIP, right? So definitely feline leukemia disease as well. All right. Oh my God, Justin, I'm so sorry about it. Your cat have FIP, right? Ivermectin will have other things as well. Don't use ivermectin in your cat for coronavirus. It's not going to help. I mean, even though this is so out of topic, I'm very sorry, guys. I go a little bit out of topic because of Justin, because everyone talk about ivermectin, you know, with COVID-19 kind of stuff. And so people would think that ivermectin, because FIP is coronavirus, would be helpful as well. We use ivermectin for something else, even with off-label, but not really treating FIP. All right, so don't think it will help, and technically and all that wouldn't really think it will help, right? Finger crossed. Hope your cat will be well soon. All right, next. Don't complicate matter to use ivermectin now, yeah? Right. Panleukopenia, that is why people call it the parvo, because it does cause bloody diarrhea when they are in the later stage. So initially, when your cat has diarrhea, like watery diarrhea, don't ignore it, okay? If your cat is not vaccinated, if they have diarrhea, don't ignore it. Don't wait until, oh, they say this virus only come with bloody diarrhea one. Also, no bloody yet, no blood yet. No need to worry. Wait for another 2 days before I go to the vet. Please don't. When you see your cat not vaccinated or kittens that you just rescued, it's having this, please go to the vet. Don't wait until it's having bloody diarrhea. Okay, that's how a panleukopenia virus in a very bad stage. So most of the time that you will see is that cat with rhinotracheitis, most of the time you will see eye lesion. Most of the time the eye would be having discharge, or sometimes so-called bluish. Okay, then you will have trachea, so they always goes like like that. Okay, so this rhinotracheitis kind of move. And then chlamydia looks very similar. Okay, chlamydia look very similar, and plus very bad conjunctivitis. Okay, in chlamydiosis, I don't know whether you always see the stray cat that you rescue from the street, right? You have very thick conjunctiva that juts out. Those are most likely the chlamydia. Okay, chlamydia virus as well. Chlamydia, it's actually a rickettsia. It's not really a virus or what. Okay, a bacteria. So what you do is you usually see these kind of symptoms, and then you see that coughing kind of look. And then for calicivirus, it's quite typical that you will see the tongue and the back. We call it fasciitis. You will cause fasciitis, you'll cause ulcer at the tongue as well. So if you want to know whether your cat actually have it or the kitten that you rescue is having this, please open up the mouth and then check on the tongue and the gum as well. Okay, well, lastly, we want to share with you about this rabies. Even though in Malaysia, rabies vaccine is not really compulsory, okay? But if you are planning to bring your pets to overseas, please plan this rabies vaccination, because the timeline is at least, I think, to US, right, is 2 times. That means 2 booster, 1 vaccine, 1 booster, 3 to 4 weeks apart, and then another month before you can travel. So there's a lot of people, they will try to get us to backdate the vaccination and all that, and we never do for them. And they get very upset because they can't bring the cats or dog to oversee within their time frame that they want. Why we didn't do it for them? Hey, doctor, just sign only ma. So easy, you cannot do, man. You change the date, sign only. Why we didn't do is because why they need that 1 month is because after 1 month, the antibody go up and then it goes down again, and then it goes stabilized. If when they are going really up, and that's the time when you reach US and they draw the blood from your pet and it's at the infectious kind of level of titer antibody, then they will put your dog or cat down there and then. All right. Why? Because they will think that your dog or cat already contracted the virus. So you must allow this 1 month so that the virus will get stable. I mean, the antibody will get stabilized a bit. All right. So that's how it is. So as you know, we talk in the zoonotic class, the movement. So it's because it's also related to a human. That's why the vaccination is important. If you are at the northern part of Malaysia, I would recommend you to do it. It's not a must, but if your dog does go out to walk and all that, I would really recommend you to do of this rabies vaccine. Please call your vet first before you go for the vaccine, because sometimes they don't keep the vaccine because it's not commonly used. All right. So make sure when you do this rabies vaccine, remember this, whoever that want to bring your pets overseas, make sure you microchip your pet as well, either at the same time or not the same time, it doesn't matter. But when the vet need to produce you the cert, right, they need to know your pet's microchip number. Then only they can actually produce the cert with the microchip number, the batch number, and the vaccine. All of these details are very important. All right. So everyone understand about this rabies already? Oh my God, it's already 1 hour. Can I ask you for another, like at least 20 minutes, like 15 minutes, for me to really tell you some Very important stuff. Is it okay? If it's okay, type a 99 for me, please. I don't know, it's already 9:30. Am I too long-winded? Oh my God. I hope I'm not too long-winded. Just want to, if I'm too long-winded, just type in the chat for me to know. All right, let's go on. Longer the better, Justine. Thank you. Thank you. Most of the people by now, right, already sleeping. Okay, after dinner, what do you expect? Okay, how does antibody work? How does antibody work? Vaccines are all or designed, right, to do it as okay, this long thing you can actually snapshot it lah. Okay, what it does is, like I told you, the DNA of the virus, they actually get this DNA or the protein or the RNA that is in this virus put into your body. It's just like the square virus get the square antibody. So the square virus come in, the vaccine get the square virus come into the body. The real virus is square, then the one that vaccine it's already weakened, or they take out part of it and then put inside our body. Then our body antibody will say like, wow, what happened? Why is this new thing come into my body? Then what happened is that this is what it happens. The vaccine goes into the body gets like, wow, what is this? So they start to recognize this thing. Wow, this one is new one that I never see before. Wow, it's square one. Then the body quickly bring out all the army to try to know this virus. Oh, this one square one, never see before. Okay, square one. Then they will design the square antibody that able to bind into this thing. So this lymphocyte, which is also the white blood cell is the body army, okay? The army of your body. This white blood cell, why it's called the T lymphocyte, is the lymphocyte, okay? You don't have to know what T lymphocyte is, but this T lymphocyte will actually have the memory, produce the memory of this square virus. This is the formula for the antibody to fight this square virus. So this programming. So inside the lymphocyte, the soldier already program it down. Okay, this is the square virus punya antibody. Okay, they put it, then they keep it in the hard disk of your body. Okay, so now they have the memory of this square virus. So when the real square virus come in, so now the power virus come in. When the power virus come in, they straight away recognize, wow, this is the square virus that last time attacked us, that come, bring out. So they bring out the memory of the square virus in 1 day, 2 days, quickly pop, come up with 100, 200, 300 army, the same army that going to fight with these square viruses. Because it happens so fast, because you already have the memory. Why you have the memory? Because I have been exposed before. As simple as that. Okay. So later on, when the disease come in straight away, it can come out and protect you. Okay. Understand, right? So this T lymphocyte, now they remember the antigen, and then they have this memory, so they activate it very fast. That is why we call it immunity, because inside your immune system, they already have this soldier that fight this antigen. Okay, this is what we call the memory cell. The memory cell, that's what we call the cell-mediated immunity. So far, so good. If it's very good, can you write a T lymphocyte for me? T lymphocyte. Great. Cannot, T lymphocyte, too difficult to type. Next. All right. Wow. We now know, Josephine. TL, very good. T lymphocyte, very, very good. All right, a titer test is a laboratory test. Okay, so now that we know inside our body, right, have this antibody because they have recognized this antigen, right? So they already have this antibody. So we want to know, this antibody enough or not? Enough to fight this disease or not? If really suddenly the virus come in, the parvovirus come in, or the panleukopenia virus come in, your memory or your cell is good enough to know how much to produce or not, your inside cukup or not. So then this titer test come into play, okay? Titer test means I measure how much of this antibody, specifically parvovirus 1, how much? Distemper virus 1, how much? Adenovirus 1, how much? They recognize this antibody produced by the cell from your blood, okay? From your blood. And because it's stored in the body, it's stored in the blood. So the purpose of this antibody is to protect the body. So we want to know whether it's high enough to protect the antibody. So most of the time, mid to high level, it's able to protect. Do you know that one of my clients just showed me that the coronavirus titer can be tested already as well in the market? Do you guys know? Who knows? Who knows that the COVID-19 vaccine, antibody titer can be tested already? You see, human are doing it as well. But we dogs has been doing it for years. We have been doing this antibody test like all the other human antibody tests for years. If you have a dog for more than 5 years, if you do not know what antibody test is, it doesn't matter. Now I teach you. Okay. Most of them, some of them even have a pet for 10 years and never know what an antibody test is, even though they diligently go for vaccination every single year. And when I tell them about antibody test, most of the time I need to spend like half an hour in the consultation room. That is why today this class is so important. Okay, so this antibody, let me show you how usually this is WSAWA, WSAWA, World Small Animal Association, how they actually test the antibody test. Then I'll tell you what kind of antibody test is available, okay? Initial, after they do all this puppy vaccine, after 16 weeks, 18 weeks or older, right? After 4 weeks, they already start determine. So they take the blood and check whether it's positive, got antibody or no antibody. No antibody straight away on your right hand side. You repeat the vaccination once using a different product. Why? Because like I told you, sometimes the body, sometimes inside the body, right? With this kill virus cannot. Must use the modified virus, then only can. We do not know. Sometimes you use modified virus, modified live virus cannot have the antibody. Then you use the kill virus or you use the recombinant virus. Okay. And then after that, after about 4 weeks, you repeat the antibody test again. Okay. You don't really have to know this because in Malaysia, we don't really practice this. Okay. Why we don't practice this? Because there's a lot of effort from the owner and the the vet. Definitely the vet has nothing much to do other than drawing blood lah. But very kesian, the baby has to be draw blood, that's one. And second, definitely the owner has to pay a lot more. And third, but this is the best way to do. Okay, this is the best way to do. I'm telling you the best way. I'm not saying that you must do this. Okay, this is a world recommended way. Okay, so if it is already positive, then you go on the booster. If your dogs, like I told you, the leptospirosis, right? The red urine one, the leptospirosis, remember? The vaccination only lasts for 9 months to a year, remember? Because of the 9 months to a year of leptospirosis, your vet asks you to go for vaccination every single year. Okay, so if let's say your dog is inside the condo, no rat, no leptospira, not going out to the park, never go out, even go out to the park also on the pram. never really touch the floor, then you don't really need to do the vaccination every year. Then you can actually do the antibody test every year. But what we usually do now is we recommend it or we recommend this antibody test to an older patient. Later on, I'll tell you why we do it for the older patient or patient with chronic diseases. All right. So then if negative again, then meaning the puppy really maybe cannot be a non-responsive one. They are puppy like that, very, very rare. But that one puppy that we have that has distemper, that cannot test by normal distemper test kit. We have to use a special PCR test kit to test that to know that it is a positive case. All right. Very sad, but yeah. So if it is not responsive, it's unprotected, they will probably get affected in some point of time. All right. So the titer test, what kind of titer test do we have? So the truth is not all the test or not all the viruses you can have titer test lah. Okay. What we have for cats is we can actually use leukemia. Leukemia antibody test is not very how to say, it's not very common. So again, if you want to test for leukemia antibody test, you need to contact the vet. Like us, right? We keep some of this, and I truly understand why other vets don't want to keep it. We keep some of this because we really don't have cases to use it, and we don't simply push it to people or cats owner. Actually, we have at least 3 tests that is expired. It's on us now lah. So we have to actually throw it away because it's expired. And that is why some of the vets or most of the vets don't keep leukemia antibody test. Okay. FIV antibody is a routine sometimes. So most of the FIV, FELV test that you test, FELV, they test antigen. That means the virus. Then the FIV, they test the antibody. Understand? The normal FELV, FIV test, I say again, FELV, FIV test is FELV is antigen, that means virus, detect virus. FIV is antibody. So if you want FELV antibody test, is very rare. You need to pre-book with your vet first before actually they buy it for you. But whenever we buy, we have to buy a box of 5. So at the end of the day, last time, because I want to help one of the patients to get the test in, I buy 1 box. At the end of the day, 3 tests actually expired. All right. So coronavirus is what you call the FIP, Justine. FIP virus, right? The antibody test is actually a coronavirus test kit. And this coronavirus test kit, if you really want, the one that really give you good result is BioGel, BIOGAL, BioGel. BioGel test is one of the best that you can do. Is most specific. It's very difficult to read the test result, but it's the best in the market that detect very well. Okay, and then if you are highly positive for coronavirus, doesn't mean that you have FIP. Okay, I don't mind helping you, Justine. When you come to the membership area, do ask me about it. I really don't mind helping you since your cat is being diagnosed with FIP. Okay, so I'll help you personally later. And coronavirus, FPV, like I told you, is panleukopenia, and then calicivirus and herpes virus. All these have antibody tests. Again, I remind you, they probably don't have the antibody test, so don't go there and make a hoo-ha with your vet. Call them first, ask them that you need this, tell them that you need this if your cat is really old, and then make sure they have it. For dogs, you have parvo, distemper, adenovirus. Yeah, these 3 antibody tests as well. Okay, parvovirus, distemper virus, and adenovirus. So leptospirosis you don't have because you don't need. Okay, because you don't need. Thanks. All right. So when not to vaccinate your pet? Okay. If they have chronic diseases, what are the chronic diseases? Can someone tell me some chronic diseases? If you want to type in Mandarin also can, doesn't matter. Siong asks, can it be some dogs that being vaccinated every year but doesn't get any antibody? Yes, there are some dogs like that. So usually what we'll do is if we test them, they don't have antibody, we give them another booster jab. That means one jab now, another one jab 3 weeks later. And then after that, we test their antibody again 2 to 4 weeks later. Understand? All right. Come tell me what is chronic disease. Okay, FIP could do. CKD, very good, John. What else? Come, tell me. Definitely cancer. You don't vaccinate your cats or dogs anymore if you are suspecting them to have cancer, or if they already diagnosed with cancer. Please don't. Do the routine check, definitely your biochemistry check and all that, and then do your antibody check. What if it is cancer and your antibody is very low? Then keep your cat at home, don't go out. All right. Hey, other than CKD, give me other things. Come on, come on. Fever, if they have fever, definitely. If they don't really want to eat, suddenly they get inappetence. Okay. And then I want to tell you what is high CRP. CRP is called the reactive protein. So sometimes some of the dogs or cats, right, they don't really feel sick, especially I will tell you, cat. Cat, especially when they have pancreatitis, right, you wouldn't know they have pancreatitis. Cat, when they have kidney stone, right, you won't even know they have kidney stone. Cat have heart problem, you don't even know they have heart problem. Okay. And sometimes because they have this reactive protein, that means inflammatory protein high, then we do not actually vaccinate them. Liver disease, very good, Angela. Thank you very much. Flu, flu not really a chronic disease, but can be. Heart disease, yes. What else? Any chronic disease? This chronic pancreatitis as well. Pancreas when they have it. Yes, kidney disease, Vincent, very good. Okay. Diabetes, very good. Diabetes is one of the reason. That is why today I suddenly thought of this patient called Xiao Bai. It's a diabetic case that we have been managing, and he's doing very well now because the daddy has been very dedicating. All right. This diabetes has been there, so I would recommend in diabetes patient, right, be very careful with your vaccination. If your dog or cat has diabetes, especially cats, a lot of cats has diabetes. Okay, if your cats or dogs have diabetes, do not vaccinate them first. Get themselves checked. Get your cat or dog checked for the antibody. If their height is good, if they are not high, then don't. Diarrhea is not really a chronic disease, but when your dog or cat have diarrhea, also cannot be vaccinated. Yes, but it's not called the chronic disease. Chronic disease means a disease can be there for a long period of time. Okay, long period of time. Okay, great. Yes, I have done with all that I want to share. Any question from you? Pancreatitis, yes. Chronic pancreatitis. It's also very, very important. Great. Thank you for your attention. Have you learned something today? Have you learned something today? Very good. Very good. Then if you don't have question, I'm going to ask you question next. All right. Thank you so much. Learn a lot. Thank you. Yes. I really would like to thank you guys for taking your Friday off. Friday is actually, I expect only 10% to come to this class because it's a Friday night. All right. Thank you, Vincent. I'm grateful that we still have about 30 of us. That's very good. I want really to thank all the members, people like Vincent, Puisi, who else? There's quite many of our members here, right? Christy, all of this has been with us for the whole 1 year. All right. And some of them, like Vincent and Christy, I think has been with us for more than a year. Like, oh, thank you. Melfi is here too. Great. Right. So what happened is that this sharing that I'm giving you and whoever, thanks for everyone that has been paid to come for this class. I know it's like expensive to pay 50 ringgit for the class, but I'm really grateful because you not only spend time, you spend money for your pets to learn about this as well. But I really want to give you something most like special. People like Margaret and Vincent and Puisi and all this gang, right? And Christy has been with us for a year plus because they are the Pets Hero member. So they always come to, you're not a member. Yeah, that is good. I just share with you what the members get. So because last time our membership price is 200 ringgit, and some of them like cannot really like just come up with 200 ringgit, even though it's more valuable. But we actually have now have different variation. I'll just share with you guys. Yeah, I'll just share with you guys how of this membership look like. So now we have another tier of membership, which is 50 ringgit only for Go member. You actually get the voucher. You have one talk for free because one talk is already cost you 50 ringgit. So it's just like you're prepaid for the talk lah. But all the other talk, subsequent talk that you want to come in for, which we will be doing at least 2 or 3 months once, will be this 50% off. Okay, whatever time that you sign in lah. Okay, and definitely you will be in the Facebook community. All right. Next, what we have is the normal membership that we have, which all of these members are now having, is that it costs 200 ringgit, but we will give you back the 150 ringgit Shopee cash voucher. And I'll give you, actually, right, we used to have only 4 classes, but over the pandemic time, I realized that we actually share more than that. I think we have at least about 5 to 6 classes already, right? We have 7 classes, I think. So you can actually go for all these 6 classes for free, okay? And then now, because it's near Christmas time and because, you know, you need to renew membership. Last time we used to give you t-shirt, right? Membership t-shirt. Now we want to give you something more valuable. We give you one members kit, which have our products like DMG, paw spray, and even some toys that worth about 180 ringgit. And also you will be in the members group. And what is the best thing in the members group? I think you guys have not been really utilize this members group, because you can actually share a lot of things in the membership group, because like what Vincent said in the ad video, that you don't really learn things from me, you learn things from your friends in the community as well. And I think that is really priceless. And for you to be able to feedback to me, like, you know, what kind of topic that you would like, so that I will customize my class according to your need, I think that will be great as well. People like Justin will tell me that, you know, have FIP, right? And so happen that I'm very well versed in FIP, then I will try to, you know, gather more information, more latest information, especially, you know, whatever things that they are using now, whether it's safe to use, not safe to use, whether, why is it not safe, why is it safe, why is it worth to try. All of these things would be able to share in our classes. All right. So, well, if you are very happy with our offer, I would really think that you should scan the link. Is it? Scan the link, scan the QR code there. It will bring you to the sign up page. All right. So I think That's all from me. I would want some question. Is there a question that is there? Any question there? What thing? Very worth, oh. I also think too worth already. Next year, I cannot give so much already. But I really want to. Oh, thank you. Kashmita. Kashmita is new. Yeah, I mean, first time I see your name here. Thank you. The miracle spray. I really want to thank the community as well. Actually, it's because of the members in the community and my patients that comes into the clinic that have problem with the human alcoholic spray, alcohol spray, sanitizer. That's the whole reason why we push ourselves to work out this spray. And I'm really grateful that the spray helped you guys. Thank you so much. So don't wait, go and sign up, and then I'll see you guys in a while. Oh, one more thing I forgot. I'm so happy that I forget. We are actually planning a Christmas get together, okay, that you can bring your pets to come. We'll find a place that we can accommodate, you know, the cat and the dogs, or we can just come out and really sit down and share and chill with our pets. All right, we'll let you know the date, but it's tentatively mid of December. All right, thank you so much. And we are also to share with you, we're also for next year, we're also working on with some membership area that you can also access all these classes that we have gone through, things that you are not cannot remember, you want to go back and listen to what I said, please do it. Okay, thank you so much for all your time. Really, no question for me. One last 3 more minutes. I'll give you some time to sign up, but other people can ask me questions. Too good that no question, or too blur, too much to be in that you have no question. All right. The next time what I'll do, right, in my classes, I would, okay, if the pet already vaccinated, if you mix with other that is not vaccinated, your pets will be protected. Okay, if you really kiasu, right, really kiasu, that you want to know it will be really protected or not, you do the antibody test. Okay, otherwise, if it is like that, most of the time, the dog that's being vaccinated, which is your dog or your cat, will be protected. But the one that is mixing with you guys that is not vaccinated might get things from your pet. If your pet is carrying it, your pet will be fine because they can fight. But the other that is not being vaccinated is not. That is why we always be very careful on mixing kittens, puppy with adult dog. Okay, kittens, puppy, as much as possible, not to be adult dog. Are healthy but old dogs still able to vaccine? Now again, that I'm telling you. Oh, one more thing. Yan Xiang is a very good question. Now, if a healthy but old dog means 8, 9, 10 onwards, kind of dog. If they are healthy, their antibody is great, but I told you, right, leptospira only lasts for 9 months to a year, right? So what do? You still want to run them, you still want to bring them to the park and all that. What do? They are one vaccine that only vaccinate for leptospirosis, called L4, leptospira vaccine. They have 4 different strains of leptospira in that vaccine. You can actually give the vaccine injection, but not including distemper, parvo, and adenovirus, only leptospira itself. Okay, if puppy not vaccinated, can we bring them out? No. If you ask me, I will always say no. I know that's the time of socialization and all that. At least 2 vaccine done, 2 weeks after the 2 vaccine done, you can, but not to, like, you know, play with dogs. But after the 3rd vaccine, 2 weeks after the 3rd vaccine is like how we are now lah. You don't get to go into the restaurant or anyway if you are not fully vaccinated with 2 vaccines and 2 weeks after. Why 2 weeks? Because after 2 weeks, then only your antibody be ready. Okay, so it's good, Josephine, not to bring your cats or puppy, kittens or puppy out if they are not fully vaccinated, not to mix with other dogs. Okay, my cat is more than 7 years old. Does he still need to do yearly vaccine again? You go back to the reason. If he's going out, if you're not sure whether the antibody is good, do the antibody test and make sure if it is okay, then you don't have to vaccinate. Most of the time, you can actually drag for at least 3 years before vaccinate them again. Okay? Why cannot delay kitten and puppy vaccination? Just now I told you already, when the antibody become too low, then only you want to vaccine, right? Then it goes up, it doesn't go up to the level that we want. So the 3 to 4 weeks apart, right, is when it comes down. Before it comes down too low, you give another booster, it goes upper, higher antibody that you want to. Then another way, another higher one, and then comes down to the protective layer. Clarifying question. It's only dog vaccine lepto antibody only for 9 to 1 years. I don't understand your question, Joyce. If you can actually write in Mandarin, I can try to comprehend that. Wow, Vincent, so fast. Just do it. Thank you so much, Vincent. Thank you for your support. We're gonna do this more because if you can recommend, try to help other pets owner by introducing us to them. We really want to educate as many people as possible. The other day I was so touched because there's one people that I doesn't know come, I don't know, they come to one of my zoonotic class, and so happened he is like a volunteer to help these stray kittens, and whatever that she learns from me, right, she go and teach all the cat feeder on the sporotrichosis and all that, how not to touch them, wear gloves before you touch them and all that. I'm so touched. I'm so happy with all the time that we spend to produce all this content and sharing. Is superb. And I'm not only teaching you, you are going to teach others, okay? Just spread the right information out. Thank you so much. Right. Oh, okay. Yes, it's only leptospira. It is only leptospirosis that will last only 9 months to a year. All the other antibody might be able to go up to 3 years or 5 years. Okay? Yes. If you do not know whether they are going to go on 3 years to 5 years, especially cats, you test them for antibody tests. All right? But the antibody test is definitely more expensive than your normal vaccination. All right? If you miss their yearly vaccination by a week, it's fine. Usually, the yearly vaccine, if the kitten vaccine has been done well, now that you know, most of the antibody could last more than a year or probably up to 3 years. So delaying, because now, like last time MCO, right, you have to delay a few months of the vaccine, it's fine too. All right? Thank you. One last question, Yan Xiang. Okay, do you need vaccine stray dog? Okay. Wow. It's a $1 million question. Okay, we always do that. When you do trap and neuter and release, we will recommend you to do that. But it is also a risk of doing that, because after they go through the neutering, right, most of the time their immunity is low. And when their immunity is low, we are giving the vaccination, we're actually taking a risk. So whether they can really, come down with it, because it's a modified life vaccine, they might come down with the disease, or you can do recombinant vaccine, which is slightly safer, but you still get the risk of taking them towards having the disease. Okay, so if a dog that you can those pamper stray that you can vaccinate first before you spay, that's the best. If those really crazy can't do, is a TNR kind of case, then you have to take the risk of vaccinating them. All right. What is the harm of taking vaccination yearly? Okay, one last question. Yeah, thank you everyone. So the other question, if you want, you can actually ask in the members group. All right, I will still try to answer you that. The harm of taking the vaccine yearly is that for cats, they might be an injection site reaction or injection site cancer. That's one. For dogs, that's a lot of time. Sometimes will have this immune-mediated issue, like blood cannot clot properly. The red blood cell is dying because of the vaccination. But these are not like very, very common. But sometimes if some cancer dog or some chronic kidney disease dog or heart patient, it's just like human. Human, what you see like coronavirus, some people, right, they take the coronavirus vaccine, the COVID-19 vaccine, right? They take the vaccine, they die. They take the vaccine, they have heart disease. It's probably not so. It's probably because they already have the underlying disease. So the same thing like us, like cats and dogs, if they already have cancer, you knew it, and you still give the vaccine, wow, you're actually challenging them with the vaccine, which then they will become very, very sick. All right. Great. It's already 10 o'clock and you guys are still here, full attendance. Thank you so much. Oh, sorry. I'm muted. I'm very sorry. I'm muted, but I'm too excited. Why Joey want to say that? I say they give you all the vouchers, still not enough. They give you all the classes, not enough. They give you all the gift, also not enough. Now they give you more things. So please click in the comment box, register, and then give and take all your gift. I'll see you in the membership area. Bye bye. Good night. Thank you.